We'll be looking at another case again, which is basically a single lesion. Okay, a single lesion that can cause muscle wasting in muscles of the right hand and right eye. So if the lesion is on the left side, it will cause muscle wasting in the intrinsic muscles of the right hand and right eye, right? If it's on the left, it will cause problem in the intrinsic muscle of the left hand and left eye. Okay, so let's quickly look at it. It was a question like this. So they said that following an accident, a motorbike rider, that's what we call Okada in Nigeria. Okay, so in case you are watching this video and you're not in Nigerian, a motorbike rider actually presented to your hospital with wasting of intrinsic muscles of his right hand and problems with his right eye. Okay, so if these clinical results are as a result of a single lesion, you know that what? There could be other lesions that could cause this. But most of the other lesions that could cause this is usually what? Two nerves combined. So they are asking you about what single nerve can be what? Injured that can lead to this. And forget about the right hand and right eye. If it occurs on the left side, it should be left hand and left eye. Okay. So now they are asking you what would be the anatomical explanation. So basically, you have to name the condition. There's a single name for the condition. Then you have to state the nerve that when it is injured, it will show off like this. Okay, so quickly let's look at this. Of course, we are looking at the T1 nerve of the brachial plexus. Okay, this condition where you're having wasting of the intrinsic muscles of the hand. These are the intrinsic muscles of the hand. Palmar interosseous, dorsal interosseous. Then you have the muscles forming the thenar eminence and the hypothenar eminence. Okay, so a condition where you're having wasting of these muscles and you are having problems with your eye, that's Horner syndrome. Okay, it's known as what? T1 radiculopathy. So that means there's problem with the T1 nerve. So let's connect the lines now. T1 radiculopathy, first of all, you define it, is a compression or injury to the T1 nerve root causing weakness and wasting in the intrinsic muscles of the hand. That's hypothenar muscles, thenar muscles, and what? Interossei muscles. Okay, and this will potentially what? Affect the eye because the T1 also gives up what? Sympathetic nerve fibers that supply the muscles of the eyes. Okay, it also supplies what? Muscles of the intrinsic compartment of the hand. Okay, so you have two things right here just by lesion of one nerve. Okay, so first of all, let's define it. T1 radiculopathy refers to a condition where the T1 nerve fiber is compressed, inflamed, or damaged due to neurological deficits. And they told you that it was a result of what? An accident. So it was damaged during the accident, right? So here is the anatomical explanation. T1 nerve root. If it originates from the spinal cord at the T1 to T2 what? Vertebral level. It exits the spinal canal through the intervertebral foramen. It divides into the anterior and posterior branches. Okay. What will be the result of compression or damage? Okay, compression or damage sites. Okay, possible places where the T1 can be damaged, right? It can be damaged at the vertebral disc. That's between the T1 and T2 where it's coming out. Okay, that's through herniation or degeneration. This one you're just trying to let the staff know that okay, you know everything about T1 radiculopathy. Okay, then it can also be damaged at the facet joint hypertrophy or osteoarthritis. That's inflammation of the bones. Also spondylosis or spondylolisthesis can also cause this. Then trauma. Finally, you're now relating it to the question, which is was accident. Okay, so trauma actually caused it. Okay, these are other causes. This one, the staff will be so happy with you that you know everything about T1 radiculopathy. All right. So we have established the anatomical definitions why there'll be wasting around. Okay, since it is supplying the intrinsic muscles of the hand. Okay, compression will lead to what? Wasting of the muscles there. Then the affected structures now. T1 root compression will lead to what? It will affect the intrinsic muscles. That's the thenar, hypothenar muscles, and interossei muscles, right? It also affects the sympathetic fibers to the eye. causing a Horner syndrome. What is the characteristics of a Horner syndrome? There will be ptosis. Your eyes will be drooping like this. Your eyes will be drooping. There will be miosis. Your pupil will be constricting. Your pupil will be very small. See, the dark side is very small, unlike here where the dark side is big. Okay. Then there will be anhidrosis, that's loss of sweat in the face. But this one they didn't ask you about anhidrosis though. So, but you can still mention it. Okay. You are just trying to show the staff that you know everything about T1 radiculopathy. Then it will also affect sensory fibers of the middle arm and the forearm. They're talking about the clinical presentation now. You are relating it to the question. The patient will present with weakness or wasting of the intrinsic muscles of the hand. The patient will have Horner syndrome. That's ptosis, miosis, and hydrosis. Okay, that's eye problems. That's why they put the eye problems in brackets. Do you know why they put it in brackets? Because they want you to list the eye problems that the person will be having, which is ptosis and miosis. They still add anhidrosis, which is basically drying on the face on that side. Okay, then there will be pain or numbness in the arm, forearm, or hand. By doing this, I'm sure your staff will give you extra mark. Okay, so that's it about the lesion that can cause wasting in intrinsic muscles of the hand and cause eye problems.